just sharing the kind of the quick tidbits of what we've learned and what we're still learning in the process. But at the end of my presentation today, I will be sharing a lot of resources to link you up to those who are experts as far as legal and considerations and training and what have you. So I will share my screen here. All right, can everybody see this okay? Great, okay. Let's see how I can click through. Okay, so I'm just taking a really quick overview today of some just key considerations regarding telecounseling. Our team embarked on telecounseling training last year, and we went through the training in the fall, and it was really designed as a measure in which to really reach our students who are training on rotation sites all over the state of Ohio. We'd love to be able to reach the ones that are out of state, but I'll get to those limitations a little bit later. But we have students who are doing a lot of their rotation work not near campus, and we wanted to be able to facilitate counseling support services to them, because what we know about our student population is when they start to shift into their rotation years, the stress level gets pretty high. To the point where the numbers, I think the national average for medical students going into their third year is the prevalence of anxiety and depression is about 39%. So this is why we wanted to make sure that we had a way in which we could facilitate this. And it was very good that we were progressive in some ways to be able to get this training ahead of time, considering COVID. So this is just our journey. The points that I'm pulling from today are just kind of looking at definitions, the benefits, risks, and limitations, the ethical and legal ramifications, the importance of client eligibility for this type of service. Technology we'll breeze through because that's not my expertise, but it is an important consideration for this process, and some other things to think about. And largely a lot of this material, I do share the link to, I pulled a lot of my information in addition to the training from Higher Education Mental Health Alliance that created a really great booklet, and I do share that information with you at the end. Okay, so what is telecounseling? So I'm calling it telecounseling. In some fields, they're calling it telebehavioral health, telemental health, virtual counseling, telepsychology, e-counseling, e-psychotherapy, internet-based psychotherapy, or just plain telehealth. And when I think about telehealth, I think that is the large umbrella encompassing not only just mental health, but all aspects of health. So when we narrow it down to the behavioral health field, our comfort level is telecounseling, but it is largely depending on who you go to, there's a lot of variety in what word people are using. And there really is currently, I think, with this age of COVID, pushing technology advance and people really quickly steering toward telehealth forms, there's going to be probably a development of standards, which I think is really good for this area for conducting therapy. So looking at the benefits and risks. And sometimes when I look at a benefit, that same benefit could be a risk as well. So there's increased access. So that's the good thing, right? That's what's largely really useful for us right now as we navigate that limitation of, shelter at home and, navigating that social distancing requirement. So it's still allowing that access to those supportive therapies. The convenience of it, obviously, this is not my background of my office. I'm able to work from my home today, so there's some flexibility there. I don't have my flowy palm tree like Doug has in his background, but I could. I do have a picture of Hawaii from last year that could pop up. But anyway, and also there's social justice for underserved populations, but also underserved populations may not have access to the technology. So that's where, those services, it could be good, I think we're looking at a lot of loosening of the parameters for telecounseling that we've seen since March and April. We've been following the law so that people could have more access during this sudden shift in, trying to get to resources. So they were saying, hey, FaceTime is okay on the phone, when largely that was not a protected area. But, state legislation and federal legislation are saying it's okay. We have a pandemic going on right now, so we're going to relax that. So I would see those kind of legal parameters kind of clink back up into establishing some norms there. And it's really related to HIPAA and protected privacy and using venues that go. So I'm getting a little bit ahead of myself here. And it's also a barrier removal. There may be some client populations where it is really difficult to come into the counseling center, or maybe they can't leave their home. So this is a beginning place, so it can remove that barrier. The risks involved are confidentiality. So once we go on the internet and we're using these technological devices, even though we try really hard to put in those protective parameters, it's still putting things out there and we're still at risk. Also, let me move my little cube here so I can see my, and we were back. Okay. So, there's also the biggest thing that we've noticed as counselors that concerns us most is the crisis intervention, that we have limitations to that. If a client was ever presenting with serious suicidal ideation with intent and they were in our office, we had the ability to execute getting emergent services for them, and be with them through that process and explain why we felt it was important to do that. When somebody is over on the other line and somewhere else in Ohio, because we are sticking to our parameters in Ohio, we don't have that ability to just keep that person calm and keep them there because we're distanced by that, they're not in our office. So it is a big concern, but there are some ways that I think that they're beginning to take a look at to help. I think there was even, I'm going to be reviewing a CAMS presentation that was talking about how to implement CAMS work training into telecounseling. So really taking a look at those risk factors. The other part of it is keeping up with the ethical guidelines surrounding this. It's constantly evolving and changing. And again, I do believe that we're going to see a lot more laws put into place after this big change with COVID. Other risks are insurance reimbursement. In some cases, some insurances will not reimburse, or there's limitations to that. So it's something to pay attention to, in client safety, as I mentioned before. Okay, so other types of limitations are with technology, you always have run the risk of the potential for service disruption. Actually, I was in session yesterday with one of our clients, and the bandwidth was just not working for us. So it became a very choppy session, and it was very frustrating therapeutically because we were dealing with some very complicated issues. So, so for that, technology works well when it's working for you, but when it's not, there are some problems. So what we had to do is just switch to phone conversation, and telecounseling can involve that phone in addition to the video conferencing as well. The therapeutic effectiveness of versus face-to-face counseling. As a counselor, I really rely a lot on the facial expressions and really observing body movement and all of those kind of nuances that you really can feel in the session when you're in room with someone, to kind of get that sense of like they get what I'm saying, or they're kind of starting to glaze over or what have you, or you can tell there's their face is saying one thing but their body's saying something different in their body language. So there is a bit to that it's not the same. It just isn't. Best practice is face-to-face, but when you take into other considerations, you know, if this is the next best thing, it afforded us the ability to keep connected with our students during COVID. So there's a lot of benefits to that versus right now we're still continuing with telecounseling at Neomed because we are in office spaces that are pretty small, and it would be very disruptive to the therapeutic process for us to be wearing masks or get into plexiglass and things like that. But there are other offices that are working towards that. We do have like a setup if somebody were to walk in to keep those safety measures in place. But telecounseling does create that little bit of safety measure regarding right now with our pandemic going on. So as I mentioned, there's also the confidentiality of the location. There's some limitations there. You have to be really sure that the client is staying in the same place each time that you're doing this session. And the reason being is there's an importance of establishing that locality, because what we have is a plan for disruption of care. This is something that if you lose connection and you have reason to believe that the client is unsafe, that you know where they're at, you know their address, you know who their safety contact person is. These things are identified way ahead of time. Who are the local police? What is the local hospital? What is the local crisis center? That this is already pre-established, that the client already has in hand and you have as well. And they know if there was reason to believe that we got disconnected for whatever reason, and it was building up to having serious concern about safety, self-harm or self to others, that they should know well in advance that that plan is going to be enacted. And that's something that you do ahead of time. Again, I'm kind of skipping ahead of myself, so just kind of giving you these little sidebar things. You know, again, we look at the overarching quality of the therapeutic interaction. So now we'll take a look at the ethical and legal considerations. So, you know, being at our institution, we're bound by FERPA law. And right now it's not HIPAA. But HIPAA does have guidelines when we talk about transmission of you know, protected data for a patient. So there are things that you have to be in compliance with. There's also a high-tech compliance that is related to the government and technology and safety and, you know, how information is exchanged. So it's really important to pull in your legal team to take a look at those considerations. It's really important also to have someone who's certified to do telecounseling. We went through a 2-day grueling training of telecounseling last year, and you know, we're thankful for that. It was rough going. There's other programs you can do that are online that may not, that would be different, but we saw a lot of our fellow institutions, counseling centers and other institutions doing like a hurry up, quick get trained, just like many other mental health agencies. Let's get the core basics, but there is certification process, but it's not really official. They're trying to establish again these standards, and I think we're going to see more of those in place. But I would suggest going with something that you know, a group or an organization that's been doing this for a very long time. The other thing to take into consideration is client eligibility and clinical appropriateness for care. We're going to talk about that a little bit later, and I'll get into that. There's also federal laws regarding psychological assessment and telecounseling delivery. One of the snags that we ran into early on in delivering telecounseling in March was we can conduct telecounseling for our current client population because we already had pre-established clinical knowledge of their you know, appropriateness for telecounseling care. But we were not permitted by law in the state of Ohio at that time to be able to do an intake via telecounseling. Traditionally, prior to all of this COVID, you would need to do a face-to-face intake process with a person seeking services. Then you would determine whether they were appropriate for this level of care, and then you could convert to the telecounseling. Right now, we have a momentary pause in that law because of the high need and demand for mental health services because of our unique world situation. And so that's changed, and right now they keep extending the law. I think ours was for counselors in the state of Ohio, it was like until August. But I think they're extending it until we get through this COVID stuff. So, but there's also the thing that we determined is where it was okay federally. There may have been a federal law that said it's okay to do intakes. The state law was not okay, or the state law guiding certain professions, could it be counselors or psychologists or LISWs or MFTs? You know, there was a lot of variety in that process as far as regarding those professions, their licensure laws and what have you. So it's become pretty complicated. At the end of this presentation, I do have a list that someone at this, the University of Austin in Texas, put together all the reciprocity laws of all the different states, and like who's legal here and who's there. If you have licensure here, does it exchange over there? And it was a monumental task, but I do have that information. So again, there is a lot that goes into this. We had to work with our legal team to really hammer down a lot of these particular issues, because it really vaults, you know, a very sensitive form of healthcare into a very sensitive area and things in safety considerations. Okay, so coming back to client eligibility. So again, as I mentioned, prior to COVID, you do an initial face-to-face initial intake, and what you're looking for and what is considered to be the current standard of appropriateness for telecounseling care for someone is mild to moderate symptom presentation. So if there's any form of concern for safety or suicidal ideation, and it goes from moderate to severe, they would not be considered appropriate for telecounseling care, because you lose those parameters of safety. So then the question is, well, where do you send them? Like right now, like, what do you do, right? Because everybody's in this mode of using telecounseling. So if we say we can't do it, you know, but there's this agency that you can, but if they're doing the same thing, but they may be trained differently. Again, there's now specialized care to work with CAMS training with somebody who does have suicidal ideation and putting in those protective factors, but that is an important consideration. The other process is, you know, again, it has to be minimal risk factors. That's the ideal world. A private location is secured and reviewed. So, you know, we work with students, so there is that propensity to kind of like, well, I'm now at my friend's house, so that should be okay. Well, no longer we don't have that data to really direct you if there's a concern for safety, to be able to, like, I have your home address from where you were before, now you're at Susie Joe's house. I don't know where that is. And then we run into a problem. The other thing is that, you know, I think the more and more we get our student population coming in, they're more and more comfortable, and therapy is less stigmatized. So we see like, well, why can't I just sit in Starbucks and do my counseling? We can't be counseling those who are around that individual. So there's a lot of considerations too. And as I mentioned, they must, for our state of Ohio, you must be physically located within the state. Now, this is according to my knowledge from my profession as a professional clinical counselor. So other professional fields might be different right now. So I do have the links for each profession's for Ohio state law and where that goes. It's more important to use a computer or a tablet and not a cell phone because of the protective factors in the privacy controls that are related to using a cell phone. So a little bit frustrating. I think when our students first thought that telecounseling was coming out, they idealized it in a way that they thought would be just like, I'm just gonna pull my phone out and I'm gonna talk to Dr. Dougal and we'll be good to go. But there's a lot of setup that goes in this process to make sure that everybody's on the same page. Okay. Really quickly on technology, as I mentioned, you really have to pay attention to HIPAA compliance, FERPA, and high tech. And also, Right now, as I mentioned, we're really looking at different parameters because of COVID exceptions. But those, you have to make sure that you're paying attention. If you're establishing telecounseling now, make sure that you're still eligible to do the same things you're doing now that you would do in 2 months from now if they change the laws. So staying up to date with that. We use a Zoom protected, well, it is a format through a certain online format that our students have access to. And we use that platform as a way in which to execute our counseling. I know other institutions and agencies are using other programs. The only thing I want to say about this in experience is I have seen other agencies get caught in this spin of like, oh no, we got to convert to telecounseling. And they've been using these kind of chat rooms that are really not protected. And I've actually seen where a client walked into a current session with their therapist and saw who that other person was and could dive into that. So if you don't have those controls in place, it becomes risky, and that confidentiality and privacy go out the door. So I really encourage you to really explore these things and find something that is really going to put those stop gaps. The program we use is something that will not allow any entrance until we give permission to do so. It's one extra step, but it's something to think about. So, but seeing that happen really concerns me. But I think you have to do due diligence and do your part to keep protected. Okay, other practical considerations. Make sure again that you do have, if you are billing, that you do have the ability to bill for telecounseling with the insurance company. Also make sure that your staff and all your providers providing telecounseling are, they know what the protocol is. When we first started this process, I think all of us were feeling very nervous about it. And it was something very new to all of us. And it made us feel very insecure as clinicians diving into this. And so my staff was really asking for me, like, well, give me a checklist. I want to make sure I'm doing everything the right way. So I did develop a little checklist based on the things that we need to make sure that we go over with our client each session to make sure things are copacetic. So make sure they know what they're doing, and they, that where their location is and where they're conducting their counseling. Like, for example, yes, I'm in my home right now, but I have older children. They know not to come in to a session. I'm using headphones. They can may hear me talk, but they know to keep privacy away from my office space. I have a sound machine going on outside. I have all these parameters in place, right? So when you get someone outside of an agency working out of their home, some of those things go by the wayside. And all of a sudden a family member can bust in and see the person on the camera, or just by accident. So it's making sure that everybody understands the need for privacy, and that wherever they're conducting this from is a safe and appropriate place. And then also making sure that there are crisis resources for after hours, for supports for your clients, that when they're not in counseling with you, that they know where to go to access that. That just because we had a telecounseling session doesn't mean I can just flip up and do video conferencing again with Dr. Dougal at any point in time. That you have that backup format as you would with a traditional counseling session. Okay, things to get started. Make sure you get certification. Establish that a HIPAA compliant method in which to conduct the counseling through that technology. Verify. Another thing we had to check is make sure that each provider had appropriate malpractice liability insurance that covered it. And as I mentioned before, I had a checklist for telecounseling eligibility for those who were eligible for counseling. And that's important. You have to establish a standard, especially with our students. Like, somebody's like, well, how come this person got to do telecounseling and I didn't? It's having that dialogue and that conversation with them, and just saying, well, these are the criterion that we're looking for. And right now we feel like your needs are, there's a higher level of need to seek a different type of service, because we want to support you in the best way possible. Also, a consent for treatment form. We had to completely create a different consent form in addition to our normal consent that our clients fill out that was established by our particular legal department. And then also this plan for disruption of care. Again, this is a form that includes, I'm afraid if I stop share and I go to the other document, it's going to be a debacle. So if you are really desperate to see our little disruption of care form, that's fine. When we got this, I'm proud of this little form because we were the first on the scene amongst our many neighboring institutions to already have telecounseling in practice. When COVID, they were kind of seeking information and kind of like, oh, we want that form, we want that, we don't have to recreate the wheel. So we shared. So little things like that can be a real stickler when you're developing these things because it takes a lot of time and consideration. So anyway, what that form again covers is that person's phone number, an alternative phone number where they could be reached if possible, their address, they identify a safety contact person with their phone number, the local hospital, police, and emergency walk-in crisis clinic. And then they know that they sign that form and I sign the form, we go over it together and they know if this happens, if service is disrupted and we have reason to believe that I'm gonna call you first. If you don't answer the phone and I'm concerned about your safety, I'm gonna call your safety person. And if they don't answer their phone, I'm enacting the plan. This is the way it's gonna be because I don't have you in front of me. And so that way, just educating them on that process. So that's it in a nutshell. I think these are the resource links. I'm sharing ones that were kind of passed around in the kind of like university counseling circuit that have been considered to be reputable. People have different opinions. I think there's probably a heck of a lot more that are coming out now. But there is an Upper Midwest Telehealth Resource Center that we had no idea exists. And that is a good resource information to go to. That's where our legal department kind of went to get a lot of the legal parameters. There is an American Telemedicine Association that you can go to with their website. As I mentioned, this HEMA has this wonderful booklet, guidebook. It's for higher education, but it has good basics. And then ACA guide, and then the social workers have their guide, and then the psychologists as well. And then I also gave you links to the COVID updates for each licensure, at least for counselors, social workers, and MFTs and psychologists, because there are rapid changes taking place right now. So we're constantly keeping our eyes on that. So I think that is it for the moment. In a nutshell, that's telecounseling, and I'd be happy to answer any other questions.